the mind and the body are really a whole entity with, if you will, interactions and connections, so that what's going on in your emotions, what's going on in your mind, what's going on in your brain is constantly affecting how your body feels, and vice versa. The concepts of mind and body were separated in Western medicine hundreds of years ago, in part because of certain predilections of the Catholic Church in Europe, and because of the desire to separate, if you will, psychiatry from medicine, or to separate the spiritual from the physical. And these historical decisions or priorities have led Western medicine a bit astray. Eastern medicine and Eastern philosophy has always been a bit more integrated, and Western medicine has done wonderful things when it comes to acute illness and severe illness and very desperately sick people, but has struggled sometimes with chronic conditions like pain and other conditions, and has struggled to integrate the emotional and the physical. So this is an important concept, which is the difference between acute, subacute, and chronic pain. So let's say that acute pain is something that happens and you hurt, and it's up to about 6 weeks or so of discomfort. Subacute might be 6 weeks up to 3 months, or some would say 6 months, and chronic pain would be more than that. So most of these acute injuries, whether of the shoulder, the knee, the back, or incidental areas of your body that get contused, will typically go away, regardless of what you do. And there's been data and research on back pain that if you do nothing, and if you just tell the patient, just go about your usual activities to the extent you can, that the vast majority of people get better in that acute phase. If you're dealing with people with chronic pain, more than 3 to 6 months, it turns out that's a more challenging group to help break the cycle of pain. Chronic pain, which is another kind of sensation, is actually experienced, based on the blood flow studies of functional MRI imaging, is experienced in the prefrontal cortex and the amygdala. These are different parts of the brain from the parts of the brain that are lighting up with acute pain. And these parts of the brain are more intimately connected with the emotional centers of the brain. So this recent science over the last 20 years or so has corroborated some of the work that I learned from the empirical observation of Dr. Sarno and from my own experience, that acute pain is a different animal, if you will, than chronic pain. So it's very important not to treat the two the same, yet many practitioners of different sorts, including conventional and alternative practitioners, sort of lump it all together and say, oh, you're in pain. We should treat you for your pain. But what in fact is the cause of the pain? Well, with acute pain, it's often something mechanical or an injury or a soft tissue problem that will typically go away. With chronic pain, it is more likely to be in the nervous system. It's more likely to be related to the brain and the emotions. And we see that in these functional MRI imaging studies.